Today I will be sharing with you the finding we had at a study done at St. Paul Hospital in its catchment health center that was done with my colleagues Dr. Delayo and Mr. Tedros. It's on birth companions in the health workers' perspective. So this will be the content of my presentation. So to start with the introduction, as we all know, birth companion has been mentioned by WHO as one of the most cost-effective methods that can increase positive childbirth experience, and there are various randomized control trials. Various randomized control trials have shown that the involvement of birth companions is associated with better maternal and neonatal outcomes. And there are also evidences that shows that women have believes they have a better quality of care when they are accompanied by birth companions. In our setup, there was a study which was done at the University of Gondar, and it showed that 31% of mothers who delivered in this facility were not satisfied with the care they received. One of the cost-effective interventions that could be undertaken, as I have mentioned, to improve maternal satisfaction and neonatal outcome is the involvement of birth companions. But in our setup, detailed and empirical studies exploring the perception of health professionals and women towards birth companions within the Ethiopian health facilities is either totally lacking or at best it is limited in scope. So with this in mind, our study was done with the objective of determining the level of knowledge on benefits of birth companions among health care providers and to find out the attitude of healthcare providers at St. Paul and selected catchment health centers. And the third objective was to find out the current practice and the factors that hinder routine inclusion of birth companions in St. Paul and its catchment health centers. So the study was done at St. Paul and three of its selected catchment health centers, and it was conducted from September to December 2019. And health workers that were working at labor ward of the selected facilities were included in the study. In the study used mixed method study. It used a quantitative cross-sectional study, which was supplemented by qualitative study to have a better insight on health workers' perception and to have a better understanding of their experience with regards to birth companions. So the criteria for inclusion in the study were being at the St. Paul or the specific 3 health centers for more than 6 months, and residents of second year and above were also included, but the gynecologists and the midwives were those who have more than 6 months of experience in these facilities. So for inclusion in this study, all those healthcare providers who were providing labor ward service at the specific time from September to December were included. And for the health centers, there are 16 health centers that are in Addis Ababa that are under St. Paul, and from these 3 were randomly selected. And those midwives that were working at labor ward of this called Lukanda and Mikililand health centers, those midwives working there at a specific time were included in the study. So the total number of healthcare providers for the quantitative study was 51 healthcare providers. So we took all healthcare providers who meet the inclusion criteria and who are willing to participate in the study were included. With regards to the qualitative data, the sample size was not determined initially prior to data collection, but after data collection, once data collection started, our aim was to reach for a number where saturation of the collected data was reached. So for the qualitative, we used purposive sampling of the healthcare providers, and midwives and residents were included. And at the end, we included 7 healthcare providers for whom in-depth interview was undertaken. So this was the sample size where saturation of the collected data was reached. For the quantitative study, we used self-administered structured questionnaire for data collection. Data was analyzed, the quantitative data was analyzed using SPHMMC version 20.0. And for the in-depth interviews, they were transcribed verbatim and they were translated to English. A coding scheme was developed and we used thematic analysis, and open code software was used to assist in the coding process. And ethical approval was secured from St. Paul, and all participation was on volunteer basis, and the name was not included on the collected data. So when we come to the results, the study included 51 healthcare providers. From these, 26 were residents, 17 were midwives, and there were 8 obstetricians and gynecologists. The mean age of the healthcare providers included in the study was 30 years, with a standard deviation of 3.6 years. And the longest years in obstetric practice was 15 years, while the least amount of time, as I mentioned earlier, is 2 years. And among the healthcare providers involved in the study, 39.2% were knowledgeable on benefits of birth companions. So for this, what we took was there are specific benefits to involvement of birth companions that are found from Cochrane data, Cochrane analysis, and other studies, and it was shown that birth companions, they provide moral support, they improve care provided by the healthcare providers, they facilitate breastfeeding, reduce operative deliveries, and there are also evidences that show a shortened duration of labor, and they also reduce the need for augmentation, and they improve the neonatal outcome, and they also facilitate communication with laboring mothers, and with the improved care, it will reduce home deliveries and it decreases labor pain. So from these benefits, those healthcare providers that mentioned at least 3 of the benefits were thought to be knowledgeable on benefits of birth companions. So 39.2% of the healthcare providers included in the study were knowledgeable on benefits. With regards to the attitude, 90% has positive attitude. But from those involved in the study, less than 20% are low labor companions. And according to one midwife, what they mentioned was this is taken from an in-depth interview. There is no one single person who will continuously be with a laboring woman. A midwife, an intern, or resident will follow her, but they have some tasks in between, so there are a lot of times the woman will be left alone. So that is the description of the health practitioners involved in the study. So the reasons they mentioned for decreased involvement of birth companions, majority of them mentioned that there is lack of adequate space, more than 60%. The main reason, their reason for not involving birth companions is lack of adequate space. The other is the busy labor ward and the absence of partitions in the labor ward and doubts on benefits of birth companions. And some mentioned that the society do not agree with the practice. So these are where the reasons for not involving birth companions. But there are specific few circumstances where birth companions are routinely involved. These are those women who requires frequent follow-up, like women with eclampsia or women who are difficult to deal with. So this specific laboring women will be allowed to have companions throughout labor and postpartum period. And the postpartum period is the one time where majority of the women will be allowed to have companions around. And the practitioners mentioned that there were times where the companions would not hear what has happened to a laboring woman. She might go into cesarean section, or she might deliver, or she might still be in labor, but the companions won't have any information. So the main setbacks for involvement of birth companions are the issue of privacy, the existing setup, the case load, and the other thing is fear of litigation if any complications arose, and lack of adequate knowledge on benefits of birth companions. And as previously mentioned, there are healthcare providers who believe they won't feel comfortable evaluating a laboring woman with family members nearby. So among the participants, 96.1% of healthcare providers, they believe there is benefits in involvement of birth companions. More than 90% believe that there is the birth companion provide moral support, and more than half believe they facilitate breastfeeding, and around 40% they believe the involvement of birth companion, they shorten duration of labor. And around less than 2% believe they decrease labor pain. Now, when we come to the discussion, as everyone is informed, I guess, there is a recommendation by Federal Ministry of Health on compassionate, respectful, and caring maternity service for all. And it's according to that, all laboring women should be accompanied by birth companion of their choice. So the possibility of implementing this recommendation is clearly challenging. The finding from our study has showed the prevailing practice is far from the ministry's recommendation. And as around 96.1% of healthcare providers believe there is benefits of birth companions, and studies done in other African countries show that have come up with similar finding. There was a study, qualitative study done in Zambia, and it included 84 women and 14 healthcare providers. And on this study, the mothers, they appreciated the emotional and practical support of birth companions. And a good number of healthcare providers believe that the social support will give the women sense of security and help the laboring women. From the healthcare, another study done in Kenya has shown that health practitioners involved in their study, it showed that their finding was increased involvement of birth companions when the mother is difficult to deal with was seen, similar to our setup. That might be due to the comparable socioeconomic condition of the two nations. And there was one study done in Sri Lanka among obstetricians, and to assess the feasibility of engaging birth companions within the health facilities of developing countries. And it showed around 58.8% of obstetricians did not allow laboring the involvement of birth companions in their wards. And the reasons mentioned were similar to our setup. The case load, the lack of privacy, similar finding, the hindrances were similar to those that are found in our study. So from this study, our conclusion was the involvement of labor companions or birth companions is not routine in St. Paul and it's just selected catchment health centers. Though limited in scope, majority of health professionals have knowledge on the benefits of birth companions, and the reasons mentioned include lack of adequate space and difficulty to ensure privacy. And since involvement of birth companions is one way we can ensure quality of care, we provide their efforts should be made to increase their involvement. And these efforts include simple measures like providing screens, providing separate rooms for laboring and postpartum women. So these are my references, and thank you for your attention.